Well, greetings everyone, and a very good morning or good evening, wherever you're joining us from. Good morning if you're in the United States, Puerto Rico, and good evening if you're, I see participants from Saudi and different places. So welcome everyone to this webinar series, Battling Emerging and Re-Emerging Epidemics and Mitigating Strategies. If you've been joining us on a regular basis, you know that this is the fifth in our series. And today, our theme is going to be modeling the impact of non-pharmaceutical interventions on COVID-19. I'm Padhu Seshayer. I'm from George Mason University. And it's my pleasure to host this exciting session and co-organize it with some of the folks that you will hear from later. And this session is on understanding the variety of models out there and understanding the impact of NPIs, as they are referred to, or non-pharmaceutical interventions on COVID. And following the 4 successful panels on webinars during the last few months with different experts, today's panel will focus on different types of NPIs, and we are all in trying times of COVID-19 outbreak, and some of us are from completely different institutions. We have all come together and adapted to deliver collaborative outcomes in the form of designing novel webinar series, special issues, and articles to keep the momentum going in the academic community. So this particular webinar series is a joint initiative from University of Wisconsin-Whitewater, Intercollegiate Biomathematics Alliance, Illinois State University, Arizona State University, and George Mason University to discuss complex mathematical modeling challenges, theoretical and practical fundamental principles, and model-based prediction issues related to understanding of transmission dynamics of the current COVID-19 pandemic, as well as educational practices during these times. As one of the co-organizers, I'm extremely delighted to be in the company of an amazing group that I've had the pleasure of working with to host this series. I'm going to ask them to introduce themselves now. If the team can start introducing, please. Olshe.
Good morning all, or good afternoon, or good evening, depending on where you are. I am Olcay Akman from Illinois State University, and I'm the director of the Center for Collaborative Studies in Mathematical Biology and executive director of the Intercollegiate Biomathematics Alliance. And I'm delighted to be working with this very elite group.
Hello, everyone. This is Dr. Anuj Mubai, and part of Illinois State University and also working for a precision here. I work in mathematical epidemiology, and I'm happy to be part of this amazing group. Thank you.
Aditi?
I am Aditi, and I'm from University of Wisconsin-Whitewater. I work in the area of mathematical models, and I'm interested in liver modeling. And it's an amazing it feels amazing to be working with such an amazing group. And with this, I'll give it to Rebecca to introduce herself.
Hi, thank you. I'm Rebecca Perlin with ASU, and I'm so happy to be here with all of you today.
And then I guess I'm last. I'm Sarah Leisman, and I'm with Illinois State University and also with the IBA.
Thank you all. And I'm Padhu Seshayer. I'm from George Mason University, and I work in the broad area of computational mathematics and modeling infectious diseases also. So we are very excited to have you all with us today. And the purpose of the series, before I elaborate on that, I'd like to take a moment to thank you all for joining us. Those that have been joining us for every webinar series, thank you again from across the world during this COVID-19 times, which has been grave and unsettling. So this particular webinar series today, according to the World Health Organization, NPI, or non-pharmaceutical intervention, is a collection of many control policies to prevent spread of infection and their intensity and selection is governed by the local population behaviors and incidents. Lockdown NPI policies were the main components of public health policy implementation. Since the first major local outbreak in the state of Washington, USA, NPI strategies have taken an important place in nation-wide spread of COVID-19. If you remember, early spring, we focused on aggressive hand washing. Then we followed it with social distancing, including complete lockdown early summer. In August, the face mask use was what was the talk of the town. And around September, school opening strategies, as well as a second set of selective lockdowns were implemented in many countries. And all these make today's topic very, very relevant. Additionally, the influence of social behavior in transmission rates, spatial dynamics coupled with temporal dynamics, government policies, impact on educational institutions, students and faculty, along with, in terms of instruction and learning, along with challenges to implement efficient, severity levels of NPIs has played a significant role in the spread of COVID-19. So we bring you suggested practices and share experiences from leading experts, as we have done in each of the webinar series during this time of crisis. And today we have three distinguished panelists. I'm senior to them, so I can say they are very distinguished, they're between junior and mid, and they're really very successful in what they are doing, and very distinguished panelists from diverse perspectives. They're going to present diverse perspectives, and they all come from institutions, different types of institutions based on the type of students they serve, the size of the institution, genders, serving underrepresented groups, and diverse areas of multidisciplinary research. So towards this end, let me briefly introduce to you all our distinguished panelists today. We have Dr. Maite Cruz Aponte, who is an associate professor in the Department of Mathematics Physics at the University of Puerto Rico at CAE. We have Dr. Marissa Eisenberg, who is an associate professor in the Department of Epidemiology and Mathematics at the University of Michigan School of Public Health. And we have Dr. Paul Hurtado, who's an assistant professor in the Department of Mathematics and Statistics, University of Nevada, Reno. So before we start, we'd like to respectfully convey some ground rules. The most important thing to me is the last one. Please don't drive while on the conference, because I'm starting to learn that some students, and actually I'll just learn some faculty are also doing that teaching while driving. So please don't do that while this is happening. And the rest of the activities today will start with a 10-minute presentation with each of our distinguished panelists. And then we'll follow with a panel discussion, and which will be around 30 to 40 minutes. So I strongly encourage you to actually type questions after you hear from each of the panelists. So we will try to take your questions and ask our panelists during the panel discussion. So please provide your questions in the chat box, thoughts, comments on what you hear. And so we can actually relate to the panelists, because they will be giving talks and they won't be able to see they won't be focusing on the chat. So we will try to help organize those questions for them. And then we'll end the panel discussion with closing remarks by each of the three panelists. With that, without any further delay, let me now invite my co-organizer, Dr. Aditi Ghosh, to do the next part of the series. Aditi, you're muted here.
Thank you, Padu. So right now I will ask Maite to present, but before that, let me introduce her to all of you. Dr. Maite Cruz Aponte is currently an associate professor in the Department of Mathematics Physics in the University of Puerto Rico at CAE, where she established a biomathematics lab for training students and carrying out research in the field of mathematical epidemiology and the spread of communicable diseases. Her work specially targets developing and analyzing mathematical models to study the impact of clinical and non-pharmaceutical interventions on the dynamics of epidemics at local and global scales. The disease systems that she has worked on includes avian influenza type H5N1, pandemic influenza AH1N1, sexually transmitted diseases, and even the current SARS-CoV pandemic. She has trained a vast number of undergraduates, mostly women and underrepresented minorities, leading to a number of technical reports and publications with students. With this, I think she currently is training 12 undergraduate students in her lab. And today she will speak on simple mechanisms to illustrate social distancing measurements. So Maite, if you can take over right now.
Okay, good morning. Let me see. Can you see my presentation now? Yes. Okay, I will try to talk really fast about everything that I have. I will talk about mathematical models that are simple. I will talk about a project that we are doing with a colleague of mine that is an economist, balancing fiscal and mortality impacts on SARS-CoV-2. And then I will present a little bit about my research group and what we are doing now. So at the beginning of the pandemic in March, April, we did a COVID-19 toy model, right, with susceptible, exposed, infected, treatment, and things like that. And the goal of this was like to show this social distancing and this measure and how can we try to mimic what happened when we apply these measures. So at the beginning, if we have a model and we don't, an epidemic and we don't apply anything and we let it run freely, then we have this epidemic curve, well, with this prevalence. But then if we try to apply social distancing and we assume, for example, that on day 20 of this epidemic, we lower the infection rate by 50%, meaning like we close schools or we use masks or things like that. And then we can apply this social distancing measure for 6 weeks. And this lower the infection rate for 50% of the probability of infection. And then we see that we can control a little bit this exponential growth of the epidemic, right? And we stop these measures and we, for example, everybody go back to school, everybody go back to work. We assume that people are starting to be more careful, like washing their hands and things like that. So we pump the probability of infection again to 90%, maybe for 4 weeks, because we start to see how this epidemic again start to like grow exponentially. Then we can apply social distancing again and try to be like more strict, but then eventually this epidemic dies out. So this is what we're trying to do, to see like how, if we do alternating social distancing, if this will help the epidemic per se. One thing that I like to stress to my students is that if we apply only social distancing and we don't have an effective treatment, we don't have an effective vaccine, the area under these two curves are the same. So we have the same epidemic, the same size of the epidemic, but the one that we apply in these non-pharmaceutical interventions occurs like in a longer time, but then it's more, we can save lives if we have the health system is not saturated. So when we talk about flattening the curve, we assume, for example, that distancing for 2 weeks, and we lower it for 50%. But then we say, no, this is not that bad. We open again, and then we start seeing this curve increasing. But then we are more strict for 6 weeks, and then we see this flattening of the curve. The problem that I see now is, for example, if we try to, since the pandemic is like ongoing and it's really bad right now, we try to close and do social distancing and try to like control it, then we will have this level is high higher than to flatten the curve, but the problem is going to be there, and then there's no way to like let it go down, right? So these are the things that we're trying to like figure out at least. We can switch these models and, for example, see what the infectivity factor lowering will help us with in the epidemic, and then we can see how this epidemic waves moves. For example, if we are really strict on 30% for 6 weeks, we see that this peak of the epidemic is really later than if we do nothing. So again, if we, for example, impose these social distancing measures for different amount of times, we can see how these epidemics are shaped. For example, if we only apply social distancing for 2 weeks, we have this blue epidemic, and then we have a peak that is lower than the original one if we don't do anything. But then if we apply it for example, 8 weeks, that is this turquoise one, then we can see that we can have a control of the epidemic for a bit. And then if we stop this, so one of the projects that we're working on is with Dr. Jose Carvalho Cueto, that is from the Census Department, he's from the Business Department. And his economist is like how we can balance these social distancing measures and the mortality and the fiscal measures. So the overview of the project is that the epidemic carries human and fiscal costs. So the best solutions are to impose these social distancing measures at the very first, at the beginning of the epidemic. But if there's no way that we can do that, then we have to look to other scenarios. So this is the system of equations. We have the system of equations for the epidemic, the epidemiological classes, and we take account of the deaths, because the fiscal impact of the dynamic is, for example, people that are sick, people that are in the hospital, and people that die. Because I was thinking of these epidemics that is killing a lot of people that are elderly, and then these elderly people like get money from the government, like Social Security and things like that. And then if they die, this is kind of a little bit of a benefit from the government. So we're trying to figure out how this helps, or how these take place. So if we do, for example, alternating measures, we can see how these two epidemics are different. If we don't do any measures, we have an early peak of the epidemic and then an early depletion of the epidemic, as opposed to if we do alternating physical distance. So this is the fiscal impact of, for example, if the governor give money to the persons that are not working, then it's higher, the cost is higher for the government. But if we take about lives, then the death rate is really less. And this is what we want. We want to save lives doing this physical distance. And then actually, like also the physical distance help us gain time to develop like a treatment or a vaccine or things like that. So if we enforce lockdown indefinitely, then we see how these different fiscal dynamics changes. But then we can see how the cumulative death changes as well. If we have no measures, we have, for example, in the United States can be like 239,000 deaths. If we have 60% of this like lowering rate of the infection, so we lower the rate of the infection for 40%, then we have 212,000 deaths, and then this is the difference of the budget. But if we do like a 20%, like a really extremely lockdown for 800 days, then we have no deaths, but then the budget is really high. We call this scenario the Ebola case because, for example, when the Ebola hit the United States in 2014, we have only 11 cases. From those 11 cases, 4 of them were critically ill. From those 4, only 1 died. And it's because we have this massive trace of the cases that we didn't do for this pandemic. So we have different scenarios that you can see in our paper. This paper is on an archive. I will show the reference later on. So it's like how the deaths, the cumulative death changes according to the alternating lockdown dynamic that we do, like lower, being really strict for 4 weeks, with less strict for 8 weeks, and so on and so forth. So the conclusions, like really quick about this project, is like unleashing the pandemic to attain like herd immunity is the worst possible scenario because it costs a lot of human lives. So in the second best policy, well, will be a strict policy of physical distance and massive testing, also to have this tracking of cases. That will be beneficial for the epidemic per se. So for the remarks of this project, like social distancing measures works if implemented early and sustained for a prolonged time. They give us the opportunity to develop an effective treatment, an effective vaccine, and to prevent the saturation of the health department, of the health system, so give us time to like treat people, right? We don't have to decide who dies or who lives. The only problem that we see, for example, for the vaccines is how we're gonna distribute the vaccine. We're having this false security of like the vaccine is gonna end the epidemic instantly, and this is not true. And then people are gonna probably start stop using masks and stop being careful. So this back to normal is not necessarily true if the vaccine appears, and how we will distribute it. Because for example, people are talking about giving the vaccine to the first responders first. Okay, so the collaborations that we have now with the health department are thanks to my former students. Danilo is the statistical analysis coordinator, and Monica is the mathematical specialist, and they are the team that are working closely with the case tracking in Puerto Rico. So they're tracking cases, they are following up, and most of the municipalities of Puerto Rico are participating except San Juan. So it's a really bad thing because it's a metropolitan area and they don't want to be a part of this initiative, but then it's a problem that we're trying to figure out. So this is my research group. These are my 11 students. We are meeting virtually. We haven't met in person, most of us. And what we're doing now is two of them are working on how the events are developing in Puerto Rico. Well, what are these like executive orders, things that happen, like for example, the epidemic here in Puerto Rico started because of a cruise that came in March. This data, we're gonna pin it with the data. This is the prevalence in Puerto Rico, and then one of my students is doing like all these dates on what happened. For example, the weekend of the Independence Day of the US, everybody went to the beach, everybody like start partying. So then the epidemic started increasing because of that. When they close, when they lift the lockdowns and things like that. So we're looking closely at how these social distancing measures and how these government measures are reshaping the epidemic. One of the things that one of my students is doing, since we want to do a metapopulation model, is that she's doing a pin of the data of the transportation in each of the cities. So for example, in San Juan, in the metropolitan area, we can see that one of these pins gave us how many cars are going in each direction and what is the name of the street and what is the town and things like that. So we can do like a metapopulation model, and we can try to see how we can apply measures in one place or another to like try to control the epidemic. But this is an ongoing work that we're doing. And then here's all the reference that we have. The balancing fiscal and mortality impact paper that is in the archive. And then the work that I did for the pandemic in 2009, that is important because we study this metapopulation model and we explain how the data mimic how the epidemic started to grow in the country. Okay. So I think I talk really fast. I try to be like on point. So if you have any questions.
There's a question for you, Maiti. We have like, what is the A compartment in your model? Somebody wants that clarification.
How many compartments in the model?
No, the A
A
compartment.
compartment.
If you want to show that, if you want to show the first compartmental picture.
Sure. This one?
Yes. Could you explain what does that A stand for? That was the question for you.
Oh, the asymptomatic infection.
Yes. Okay.
Yeah. Because that's the main problem that we have now, that we cannot count the asymptomatic. And that's why we need to do the tracing and massive testing.
Okay. For the rest of the questions, we will reserve it.
Mm-hmm.
Aditi?
Yes.
Yes, sir.
Yeah, so it was interesting that in your model, one of the components was the fiscal impact, I believe, and you said that since most of the mortality is from elderly, that there's actually a benefit in a little bit in terms of the fiscal impact. It's actually interesting that you included this fiscal component into model. That's something I tried to implement in my model as well. But what we found out is those elderly, they are also, while they are being treated, or for instance, when they are in ventilator and long time in coma, they are also a burden on the Medicare system, on the healthcare system. So the elderly's cost of healthcare actually overcompensates the lead time that the social benefits saved from their mortality. And I was wondering if you'd consider including one more parameter as their cost of.
It's actually there because it's this treatment times MB, like is this cost of being hospitalized.
I see.
So it's there also.
Okay.
So basically this plus is, it probably is like an epsilon, like really small benefit, not really a benefit per se.
Thank you.
So thank you, Maiti. There's another interesting question for you right now. I think it will be a short one for you, so that's why I'm poking in right now. Okay. So Asma asks you, is the plateauing behavior observed in your model, is it because of the social distancing in the middle of outbreak, or is it due to something else?
No, it's because of social distancing. I assuming only social distancing.
Okay, thank you.
Yeah.
So this will take the other questions during our panel discussion. And thank you, Dr. Cruz, for presenting us an analytical evaluation using mathematical models to demonstrate which measures or combination of measures are effective for the mitigation of control of COVID-19 pandemic in the absence of a vaccine or an effective treatment. And with this, we would like to introduce our next speaker, Dr. Marisa Eisenberg. She is from the Department of Epidemiology within the School of Public Health and Mathematics at University of Michigan. She leads an EPI math lab with focus in mathematical biology and is centered around using and developing data-driven parameter estimation and identifiability techniques to connect math models and different types of disease data. Much of her research has been focused on modeling infectious disease epidemics, including examining cholera dynamics in Haiti, Angola, and Thailand, forecasting for the Ebola epidemic in West Africa, and understanding silent circulation of polio among the Bedouin communities of southern Israel. Additionally, for the past several months, she has been working on COVID-19 response efforts for the state of Michigan. So with this, I would ask Dr. Marisa to speak on modeling to inform regional COVID-19 policy, developing forecast scenarios and counterfactuals. Thank you.
Great. Thank you so much for having me. Let's see. Okay, so hopefully you can see my screen now. Great. So I'm gonna, I always find it makes a mess out of things if I do a slide share, so I'm gonna just do it this way and click from slide to slide. Hopefully that's all right. So I wanted to start, so I thought I would talk a little bit about modeling non-pharmaceutical interventions in the context of working with decision makers and helping to inform policymakers as they're working on stuff. And so I thought I would just start with like this whole pandemic has just been such a strange time for modelers. I think, you know, we've been in a sort of spotlight that I think most of the time, if you're like, hey, I'm working on an SEIR model or something, people are like, okay, whatever, that's nice, you know? But right now, it's you know, there's a lot more attention being paid to this, and I think it means that things like this webinar and, you know, are impactful in a way that they sort of often aren't. And so modeling is playing this kind of important role. We've been working in that kind of space a little bit, just in the context of Michigan, where we've been working with the governor and Department of Health and Human Services to help inform policy decision-making and things like that. So, so I guess I just wanted to give a couple quick notes, like when it comes to sort of working with decision makers, some things that we've observed is that one, there's like this sort of fast turnaround that you don't see under most academic kind of pursuits, where you would, you know, take a year or something to finish out a paper and really do it fully and completely. And instead it's like, hey, we have to distribute these tests on Tuesday. If you don't get us your modeling results by then, we're not going to use it. Like, that's how it's going to be, right? So, so it's this fast turnaround. The challenges are often around communicating uncertainty, because when you're working like that, you know, or even if you're not, the data is not there to give you like really precise estimates at this point. And so trying to communicate uncertainty and get folks to understand that, you know, models aren't crystal balls, but they can be useful, you know, those kinds of things I think are a big challenge. And so simple, I think, ends up being really good. We found a lot of times that, you know, kind of keeping our analyses to something simple and illustrative has been really helpful. So these two pictures are one from a press conference, and the other is just like just as an example of what a weird world it is right now. This is a person protesting at the University of Michigan because they're protesting the lack of mathematical models underlying the response, which I just, like, I have never imagined that would be something that people would be protesting about, is the lack of mathematical modeling in guiding public health response. But it's kind of, you know, I don't know, there's something good about it that people are really starting to appreciate the value. Anyway, so I just thought that was kind of interesting. And maybe a sort of like, keep doing the work you're doing, this is good. So just to give a little background on COVID-19 in Michigan. So this is our epidemic curve and sort of what has been happening policy-wise as the epidemic has continued. We were hit pretty hard as one of the early states that was hit hard. And then luckily, you know, like managed to kind of get it turned around. People really, you know, did a lot of social distancing, and there was this stay home, stay safe order, which was a stay at home order. That sort of flattened the curve, turned it down. And then since then, you know, we've kind of seen this long plateau that's starting to creep up towards the end here, which has been kind of ongoing. Now, I should note that testing has increased a ton over this period. So, you know, cases here probably represent a different number of underlying infections than cases over here on the right side. So that's just something to keep in mind. But just so you kind of have a sense of what the epidemic that we've been looking at has looked like. As we've been doing our modeling, you know, our modeling goals have been, you know, mainly around three things. So one is forecasting and understanding the epidemic spread. Two is getting estimates of hospital needs and, you know, so ICU, ventilators, those kinds of things. And three, which is the one that I'm actually going to talk about today, is modeling different scenarios around intervention strategies and mitigation approaches. And that's sort of what we're going to focus on here. The model that we're using is it's actually more complicated than this. This is like a simplified diagram. We've since expanded this to have not just latent, but asymptomatic transmission and, you know, all these different, a number of other things and sort of more detail. But just to kind of give the basic sort of underlying structure, it's a SIR type model with a staged progression. We split people into mild and severe disease, severe being defined by those who are eventually going to be hospitalized. And then you can either recover or you can become deceased. And as part of this model, we also model care seeking, so testing, because there's a delay in how long it takes a person to go get tested, right? And so, and it also affects your transmission dynamics if people quarantine. So that we are modeling testing, and then we're also modeling, of course, deaths as the two sort of data streams that we're fitting to. We've done a ton of variations. Paul will talk some about this too. We've been working together on all of this. And so lots of different versions of this model, oftentimes running different versions at the same time to try and figure out answers to different questions. So I'm not going to get into all of that stuff. Although I do want to just mention briefly that one thing that's been important in this model has been looking at different spatial scales. So we've been modeling from county level to regional to statewide. And, you know, a lot of the projections I'm going to show are statewide, but they're actually built out of smaller copies of this model at the regional scale. And so that's just something to sort of mention. We're fitting the model to daily confirmed and probable cases and deaths. There's a ton of data challenges, of course, underreporting, changes in how much testing is going on, changes in social distancing. This all leads to a lot of issues with parameter identifiability and estimation, which is what I love to work on, but what I'm not going to necessarily talk about today because it's not the focus of today's thing. But if we want to talk about it in the panel, I'm totally up for it. One thing to just sort of mention is that when we think about modeling these things, I think it's important to talk about the population at risk. And that's something that we often sort of would tend to think like, oh, the population at risk is the whole state of Michigan. We know that population, it's fine. But you know, with social distancing affects people in multiple ways. It affects your contact rate, but for some people, they really isolate and then they are effectively out of the population at risk, right? And in addition, you know, depending on social structures and things like that, you know, you can have a different population at risk that's something distinct from your total population as a whole. And so I think that's something that we've ended up finding important when we've been modeling social distancing, is to model not just how it changes your contact rate, but also how it changes the fraction of your population that's actually at risk. And so that's something that we've included in the model and that I think is sometimes useful to look at. We have a sort of kind of a complex parameter estimation approach, but actually in the interest of time, I'm going to kind of skip this and jump straight into thinking about some of the social distancing scenarios. So we wanted to look at social distancing and do a couple of things. We wanted to evaluate the potential for a resurgence as we were on that sort of downtick of the curve. We were also working with the Department of Health and Human Services and the governor's office to decide whether to extend stay-at-home orders. So that was, you know, we're just providing one small piece of input there, but that was kind of a big focus for us. And then also to evaluate what the effect of social distancing has been on the epidemic dynamics in the first wave. So just to remind us, the stay home, stay safe order, you know, went into effect on April 13th, but then it was extended several times to April 30th, 5/15, you know, et cetera, et cetera. And each time there was an evaluation of the evidence to try and understand whether it made sense to extend the stay home, stay safe order and what benefits that might have, what harms that might have economically, all of those kinds of questions. And so what we ended up doing was doing a lot of modeling around what might happen if social distancing eased at a particular time and went back to normal versus if it stayed on. And so we were able to look at the possibilities. So these are just showing confidence ranges for that, you know, that range from simulations saying that if you let go of social distancing, you'll have a big second peak, to if you let go of social distancing, we've basically blown through all the susceptibles already, and it will just continue to decline. But it was sort of important for people to see that we're not out of the woods, that even if you can't say for sure how big the resurgence could be, you know, or even whether it would happen, it's still very much a possibility in the model. And so that ended up being something that was used a lot by policymakers to kind of think through, okay, how much probability is there that we might have a resurgence? You know, how important, therefore, might it be to extend the stay home, stay safe order? And so we did this for Michigan as a whole and also by region, because there was a sort of region, the stay home, stay safe order had different regional components where some restrictions were put in particular regions of Michigan and other, you know, restrictions were put elsewhere. So, so that was a lot of the work that we were doing. It ended up being that, you know, for the extensions of the stay home, stay safe order, you know, the governor actually used our modeling results in her press conference when she was, you know, announcing some of these extensions. So it was something, even just as like an explainer tool for people to understand. I mean, I think sometimes actually modeling ends up being more useful almost as an explainer of your reasoning than as anything else. And so, so that has ended up being something useful. In particular, we made a little explorable that was used by a lot of different folks. It's available on our website, and you can play around with different social distancing scenarios. So, I'll have to play with it later. We can look at it later if people want. But anyway, you can set different social distancing scenarios and play around, and that was something that got used a lot. We've since extended this to work with unicast mobility data to try and use that to model social distancing levels. I think Paul is going to talk about this in more detail, so I'm going to mostly kind of breeze through here. So we're using encounter density as measured by cell phone data to model people's social distancing levels, and then basically incorporating that into our contact rates and also our fraction of the population at risk, and then using that to generate projections forward. And the last thing I'm just going to mention really briefly is that with this social distancing data, we've been able to do some interesting evaluations of how the stay home, stay safe order, how well did it do at actually, preventing cases and deaths. And I should also say, when I say the stay home, stay safe order, I really mean the social distancing. That might well have happened even if you hadn't had a stay home, stay safe order. I don't know, it's hard to know, but what we're really evaluating here is how well did social distancing do at preventing, but people in Michigan, working to stay distanced, how well did that do to prevent cases and deaths? And so what we did here is we used that unicast data to model people's social distancing levels, and then basically switched it off so that you could compare what if people hadn't social distanced at all and it had just stayed at this baseline level of encounter density that we saw before. And if you compare those things, then what you end up finding is that the model estimates that we would have seen potentially as much as 28,000 more cases by June 1st had we not social distanced compared to having done social distancing. And we would have seen a peak that was 2 to 3 times higher than what we actually saw in practice. And for deaths, it ends up being that without intervention, we would have seen as much as 3,500 more deaths by June 1st and a peak that was 2 to 3 times higher. And that's probably actually an underestimate, because if these peaks were so much higher, it would have overwhelmed hospital capacity more, which we're not modeling, and that would have led probably to more bad outcomes and potentially deaths. So I know I'm running over, I'm pretty sure, so I'll just say, for next steps, we're working on modeling for We've been doing a lot of modeling around different testing plans and things like that. We're also working for the state level at modeling age structure, because as you can see here, so these are cases as split by age in Michigan, and you can see that it used to previously sort of be kind of consistently across different age groups, and the youngest age group was actually on the low end. Recently, that has switched, and the younger age groups are higher. And with the reopening of school, they've even popped up higher still. So it really is becoming important to think about age structure and modeling that, because you can kind of see here what looks like might be a pop-up in the 0 to 29-year-olds, followed by maybe a pop-up in the older age groups that could be transmission from one age group to another. So that's something that we want to look at. With that, sorry for running over. I'll just thank my team and the group that I work with, who have all been just incredibly fantastic, from both MDHHS, and University of Nevada, Reno. Paul is here and he'll be talking next. So thank you.
Thank you, Marissa. And we have a short question for you. So Peter is asking you, what did you use, R or Python package for forecasting?
Okay. So, and I just saw Go Blue. Yes, Go Blue. But anyway, we're using R. My lab is pretty evenly split between Python, R, and MATLAB. So it could have been any of them, but it was R. So yeah.
But I think a lot of the package that you have, probably you have designed it rather than using it for someone else, right? Is that what?
That's right. Yeah. It's our own package. Yeah, that's right. Yeah, thanks.
So yes, it's an incredible talk talking about the development, uncertainty analysis, and use of models to help inform and evaluate COVID-19 responses in the state of Michigan. So yes, we are interested to know more about the unicast data from Paul. And Paul is an assistant professor at the University of Nevada, Reno in the Department of Mathematics and Statistics within the College of Science. One of his main focuses for research has been population ecology and the ecology of infectious diseases. He uses methods from dynamical systems, probabilities, stochastic processes, and statistics to develop and analyze data-driven mathematical models. He has been mentoring students at various levels, including underrepresented and minority students. And today he will speak about modeling SARS-CoV-19 dynamics in Nevada. Over to you, Paul. So
You're
Paul,
muted.
yeah.
Yeah, thank you. I'm just getting my screen shared here. All right, can everybody see my slides?
Yes.
Cool. Cool. Well, thank you. And I'd like to thank my previous speakers. That was great. Marissa and I actually have been collaborating a little bit on this, and we actually didn't know we were in this same panel until sort of later in the game, which was fun. So I'm going to take advantage of that and sort of skip over some of the details she's already introduced. And I've also trimmed a few things down just based upon the ground we've covered so far, just in the interest of time. So hopefully I can go through this fairly quickly. So before I begin, I also have to give a little plug that I'm looking for a PhD student. And so if you're if you know anybody, or if you yourself are interested in sort of PhD level research in mathematical biology, UNR is a great institution. It's in a great little corner of the world. Lake Tahoe's just a stone's throw away. So if you're interested, I've got a little description of the position up on my personal website, and there'll be a link for that at the end, or you can just Google me and find it that way. Okay, so before we begin, I just wanted to say that in addition to my sort of academic collaborators, so this is Marissa and folks in her lab, also our sort of local and regional sort of folks from the government side of things. I also wanted to thank all the other folks out there really on planet Earth who are sort of digging into different aspects of COVID-19, sharing that information, sharing their sort of experiences, and really rapidly developing a body of knowledge about this disease that modelers can use to try and do a better job modeling this stuff. So just wanted to mention that. Okay, so I wanted to start out really quickly sort of looking at data and then sort of digging into how I think about this stuff from a modeling perspective. And then I'm gonna just sort of dive into one of the technical details. And I think we could all be here for hours and hours and hours today talking about fun technical details related to COVID modeling. So we'll just dive into this one here. So when I look at data like this, so this is the sort of daily cases for Nevada. And here I'm showing a few different public resources where you can get these data sort of all on top of each other. And they're all pretty much telling you the same overall trend. You want to sort of dig through the layers of where those data came from when you start thinking about putting a model together. And so one of the big things when we look at these data that we want to think about is what's going on with sort of the observation process, right? What's that testing effort look like? And here what I've shown is just like the daily number of tests. Ignore the fact that there's gray dots and black dots and two squiggly lines there. You can see that early on we had relatively little testing taking place, and then that really ramped up, and then it's sort of had some big fluctuations since then, both on a sort of daily time scale, but then also on a sort of weekly, almost monthly time scale. Okay, so so we want to sort of think about how do we model what we would call an observation process, if you're not familiar with that lingo. And you could go through and say, just divide and look at the fraction of those tests every day that are coming back positive. And now you get a sort of different shape to that curve of, the sort of index of what COVID looks like in the region or in the population of interest here, okay? So going through and sort of thinking about, what patterns in my data come from the observation process and what patterns in the data come from my underlying, sort of disease transmission process, right? We can start parsing those things out. And one of the ways that we've done that is to look at mobility data. This is a thing that a lot of COVID researchers, modelers have done. There's different sort of data sources out there. So Unicast is what Marissa's been using. I started off using Google Trends data, or Google Mobility Trends data, for no other reason that it was the sort of one that I stumbled across first and started playing with. And they're pretty similar, but there are some differences. And you can see, just if you haven't seen these data before, just to give you an example, it sort of breaks down mobility by, sort of recreation versus retail versus sort of residential. And I'm just showing a few of the curves here. They're all sort of similar. There's a residential curve, right, that sort of went way up at the beginning and then sort of tapered off because people were staying home. And then they sort of, relaxed that sort of isolation and started getting out a little bit more, whether because they thought that was a good idea or because they just couldn't stand to stay at home anymore, which I'm sure a lot of you have felt that. So thinking about all that, right, we want to start thinking about how we plug that, that information into a sort of framework that we're familiar with so that we can move forward with the modeling. So here I'm going to show you just a really simple SEIR type model, which if you're used to seeing beta SI as a transmission rate, here I factored beta into C and P, where C is the expected number of contacts per individual, and P is the sort of probability of infection given a contact, okay? And what I've done here is just gone through and calculated R naught for this model, which I think we all know what R naught is. And as is often the case in these kinds of models, you can usually interpret this R naught expression as the product of the sort of rate of new infections per infectious individual times the mean duration of infectiousness of your typical infected individual, okay? So that's at the beginning of the epidemic. And then as time goes on, you have a similar sort of analogous quantity, which is the effective reproduction number, which I've denoted here as R sub T. And in this simple model, you could really think of that as just R naught multiplied by the fraction of susceptibles relative to how many there were at the beginning of the population. Okay, so some of those things that Marissa just talked about in terms of, keeping track of what the susceptible fraction looks like in your population, right? That might not be the entire population of folks that haven't had it yet. You can start seeing how you might want to start building some aspects of your model around that to capture those kinds of effects, okay? One thing I wanted to add here, and I included this because this was something that I ended up passing along to decision makers here, is just going through and explaining what R naught is and where it comes from and how you interpret it, right? This is the kind of stuff that I think a lot of us who are teaching, right, we cover this in classes when we're talking about SIR type models, but it's not common knowledge, right? And so sometimes using simple models and just explaining some of the basics and how we interpret things like R naught is a really useful thing for decision makers, right? You don't need a ton of fancy modeling to do that. Sometimes, right, just explaining these basic concepts is incredibly helpful for them. So, so here, right, you can basically show that if you take this really simple model, lump together your exposed and infectious individuals and call that your total number infected, right? Rescale time by the mean duration of infectiousness, which is 1 over R sub I in this model. And if you look at that sort of derivative of total infected per unit time, where we've rescaled time this way, you see that that basically looks like a sort of simple linear function where this coefficient on I here is R of T minus 1, right? And so this is a really nice, plain, easy way to see that your total number of infecteds is going to increase when your R effective is greater than 1, and it's going to decrease when R effective is less than 1. And that then opens the door to sort of talking about, look, getting R naught down near or below 1 is great, but that's going to just hold stuff steady, right? If you really want to, decrease transmission rates, you really want to drop that below 1, not just by a little bit, okay? So another nice thing about going through and sort of looking at these simple models is you can explain sort of how different non-pharmaceutical interventions sort of influence different processes in the model, Okay, so here I've gone through and sort of factored things out a little more fully, and we see that if we look at C, this sort of number of contacts that are happening in the population, if we're isolating and doing social distancing, we're effectively reducing that number, and you can see that that has a sort of direct impact on our effective in this way. Same thing with PPE use, right? So if people are wearing masks, if people are washing their hands a lot, if people are wearing face shields, whatever, you could go through and think about, well, how is that going to influence the sort of average probability of an infection when an exposed and when an infectious individual bumps into a susceptible individual, right? That's kind of what P is this average probability of that yielding a new infection. You could go through and sort of see how that directly translates into new transmission at the population level. Same thing with the duration of infectiousness, right? If you have a good contact tracing process in place where you're able to identify people early in their infection and get them isolated so they're not spreading disease, you're effectively reducing the duration of infectiousness for those individuals. So that's going to reduce R naught, okay? So as we're digging in and sort of starting with a simple model and complicating it and thinking about how we incorporate these non-pharmaceutical inventions, right? Sort of looking at how they influence the different bits and pieces of the processes in these models and what other processes need to be added is kind of that initial first step in doing that, okay? So how does this work in our model? Like I said, I'm not going to go into all the details, but Marissa covered a lot of the ground here pretty nicely, and so I don't want to dive too much more into the details of how this model works, other than to say a little bit more about the observation model. So we went through and basically sort of broke up sort of how detectable cases are by how severe they are. So if you're going to the hospital, you're going to get tested, right? So those really severe infections, we're going to have a good handle on those. Whereas if you've got a pretty mild case, you might not go get tested at all. It might not even cross your mind to think, gee, maybe I have COVID, okay? And so we can go through and sort of build in that level of the sort of testing process. There's also time lags in what the sort of testing data, how long it takes those testing data to sort of become available to decision makers and for us to know about them. And so I was able to go through and sort of use this generalized linear chain trick framework, which I came up with, which we could talk about that more in the discussion. But if you've ever heard of the linear chain trick, this soups that up a little bit and basically allows you to take a lot of concepts and intuition and tools from Markov chains and bring those over into thinking about how you work with ODE models that are these kinds of state transition models. And so we were able to go through and sort of build a nice model of those testing lags as well, so that we could match up the data with the underlying process model in beneficial ways. And then Marissa sort of talked a little bit about sort of the sort of fancy fitting stuff that we did, which we won't go into, which I'll also skip for time's sake, but we can talk about that more later. And so then, thinking about everything I just talked about in terms of what parts of the model are influenced by which NPIs, we could go through and sort of build some of those things in. And so I wanted to focus in just on the sort of transmission rate aspect of that, which is sort of where the bulk of this, bulk of these NPIs is influencing these models. And what we can do here, right, is we can think about things like PPE use and social distancing and what sort of model parameters those are affecting, and then build in some time varying rates for those parameters using things like unicast data or Google mobility data, okay? So one way to do this, right, would be to go through and say, you know what, I've got a transmission rate. Let me just make it a fairly flexible family of curves, right? Pick your favorite set of basis functions, right? Fourier functions, whatever you want. And you could just go through and sort of see, you've got your parameters for the coefficients on those things. You add them up, you get beta of t. And then you just go through and try and fit your model to data that way, right? And let the data drive the shape of how you're going to estimate beta. And that's a very reasonable approach to take. The other thing, though, is that we have other data like mobility data, right? And so you want to incorporate that extra information somehow. So one of the ways that people have done this, and this is a trick that's been around, I think, for a while, and sort of fitting these kinds of models to data in other contexts, you could take that curve and say, let's just assume it's going to be proportional to those mobility data, right? So that you've got that curve for what mobility looks like over time. Let's assume beta is like a linear function of that. And then let me multiply that by something like one of these very flexible sort of spline curves, right? In a way that the sort of default is constant at 1, okay? And then that'll sort of pick up the slack that your mobility data is not quite capturing. So again, here are those mobility data that I showed you before, and I didn't mention it, but there's this sort of solid line curve that goes through the middle. That's just a curve that I made up that kind of fits the general shape of those data that's based on a series of spline functions that sort of look like ramping up or sort of hump-shaped things. And we can put coefficients on each of those, sort of start them off right here, and then go through and build them in. That would be the other way of doing it. So this first way of doing it, where you're sort of taking those data and multiplying them by one of these random curves, a nice example of that being implemented is through the work that the folks at the University of Georgia have been doing. So this is John Drake's lab. You can, if you want to dig into the details here, right, they've got this latent trend process, which is basically that multiplier that I talked about. What I chose to do was to go through and take basis functions that kind of look like these ramping things or hump-shaped things, and then put a bunch of those together, put some coefficients on those so that we've got some flexibility, but really we're sort of constraining what that family of random curves can look like. So this is kind of like, you could think about this almost as like the sort of Bayesian prior on some functions, right? Where you know some information about what that curve might look like, but you want to give it a little bit of wiggle room. And so we can build that in and then go through into our model fitting. And again, right, how we do that is shaped by our knowledge of the sort of different things that happened in the population, either because of, you know, sort of state level or regional level measures that were taken to reduce transmission, like stay-at-home orders, or other things that happen sort of coincidentally, like, hey, school's reopening, maybe that'll bump things up a little bit, right? You can build those kinds of things in. And I'll just end on this slide by saying that the trick then when it comes to forecasting and making projections is you don't have those future data about what you think people's PPE use levels are, right? And so when you're going through and you're making forecasts and projections, you have to think a little bit carefully about how you extrapolate things like those mobility trends forward in time, and other unforeseen things. And so it's really easy, if you do a good job with that, you should have pretty gigantic confidence intervals on your estimates. And we try and not let that get too carried away. But that is something that goes into the sort of forecasting and projecting side of this. Is once you've built in these extra processes, you have to sort of make up or otherwise have a reasonable suspicion about what those future trends are going to look like so that you can run those forward in your model to come up with projections. And as we all know, predicting the future is hard. Predicting the future about human behavior, there's a reason that I like to work on things like Daphnia and plants and insects. They're a little more straightforward to study. So anyway, with that, I'll stop there, and thank you all for either staying up late or getting up very early, depending on which part of the world you're in. And I guess we can, I'll turn it back over to you guys, but then we can do the panel discussion part of it. So thanks.
This is interesting. We bring you perspective of implementation of mathematical models incorporating NPIs first in Puerto Rico, Michigan, and then Nevada. Thank you, Paul. It was a very interesting talk. And with this, we are running a little bit over time. So I will over this to Anuj for the panel discussion.
Thank you, Aditi. It's an amazing talk with so much variations in the type of work that our panelists are doing today. And it's my pleasure and honor to actually discuss more deeper into their work, and also general questions that could help us understand the current outbreak and overall modeling how we are doing. And because we are sitting in different parts of the world and there's no conference going on, and we are just reading each other papers remotely. And I don't know if we are getting everything what the researchers aim to build in the papers. So we have few questions that we thought might be helpful for others in the community to understand from your expertise. So with that, I will just give some rough outline. And so I'll probably ask few questions directly to one of you, and then maybe expect others to jump into it as we discuss more deeper into it. So the first question I will start with Marissa. And this is, you were talking about that you are working very heavily on with Michigan. And if you see historical trend in the outbreak, literally in US started in state of Washington by this nursing home, the age-old home, long-term care facilities. And quickly it moved to New York, which was the second kind of a local hub in US. And in New York, it was completely different aspects. It was not really a nursing home, but it was probably people coming from outside by international flights or by socioeconomic conditions. So I think the question is very general to you, is about what aspect of population structure in your work, for example, in state of Michigan, that you are seeing is very critical. I mean, is it the population structure which are very static in nature, like gender, race, socioeconomic condition, or adaptive in natures for like people working in certain professions, for example, that is causing an outbreak to what aspects of the population is important to build into these models to study?
Yes, that's a great question. Yeah, no, so I think it's both. So like we've definitely seen, so we've done some basic age structured modeling, and it's very clear that there are different dynamics by age groups. So it does seem like, age is certainly important. And similarly, socioeconomic status and race ethnicity have also been, the initial wave of the epidemic in Michigan really hit, lower SES and Black Michiganders in particular a lot harder than it hit white Michiganders. And then over the course of the epidemic, as it sort of spread across the state, it kind of, a lot of those disparities have shifted and maybe it's changed a little bit. So, I think that those kind of more static things are important, but also the dynamic, population structure pieces are really critical too. So, that means a lot of different things. So some of that is, is about who's isolating and who's, who makes up the essential workforce. Who is isolating, those things do correlate with age. Older individuals probably are isolating more. We've seen that people who have lower socioeconomic status, or, also like there are race ethnicity disparities in terms of who makes up essential workers. So those things, there's correlations there, but those are critical. And capturing that like time varying like population piece, who's isolated and who isn't, has been really important for us to get the dynamics right for Michigan. So that does seem like it's been pretty important. Those things will also affect not just the transmission dynamics, but the hospitalizations and the deaths and all of those kinds of things too, which is also really critical. Yeah, and then the last thing that I'll just mention going forward that we're just starting to look at is that, one thing that like a lot of my modeling at any rate has been making sort of the mistake of is assuming whenever I'm doing models, I don't really worry that much about how much population immunity has built up already or how many people have died. But those are actually, we're often using like census population numbers. And, for some, as you slice and dice the data more fine, you get down to smaller age and race ethnicity categories. Some of those categories have been hit hard and now their numbers are actually different, at least in terms of thinking about not necessarily number of people, but like, although in some cases there have been more deaths in some of those groups, but also just level of population immunity. So I think that's going to be something we'll have to think about going forward too.
Yeah. Maite and Paul, you want to add to what Marissa just mentioned?
Oh, go ahead.
Go ahead. No, go ahead.
I was just going to say too that, moving forward, one of the things we also need to think about is vaccination, right? And so pretty soon we're going to put a big bump up in our sort of fraction of the population that's no longer susceptible or that's sort of less susceptible. And that's, all of this sort of builds up to that, thinking about the role for those things. So, yeah.
Totally. I'm thinking about rollout for vaccines. Yeah.
Yeah, another aspect is that we don't know a lot about this disease. And I was thinking yesterday about blood type and how they were talking about the type O have more have less severe infections or died less, or etc. And I was looking at the map of how the type of blood distribute during the world. And for example, in South America and Latin America, we have more type O than in Europe, for example. And then we can see like maybe this is helping us a little bit, because like, for example, in Puerto Rico, like the cases are increasing, but we don't have a saturation of the hospital, for example, like happening in Italy or in Spain, for example.
So those things will, so we all talk about these structured population. I think I'm summing up what you guys all have said in some sense. We all talk about, so what Maite, you just mentioned is the structure could be based on the blood type, for example. I don't know, I mean, just throwing the random idea, it might be useful. And what Paul, you just mentioned about is the susceptibility to the vaccine might be very different from one population to another. I think that would be very critical for how you divide, and it depends on what region you are modeling on. And Marissa, you are talking about the shifting trends. How do you capture that shifting trend? It's not a static anything, and it is changing over human behaviors, because the human behavior is very critical. And then we talk about narratives by the political leaders. So red state versus blue state, and that is the human behavior also. So very good. Yeah, someone wants to add something? I heard something. Okay. So so these are amazing point, and I think sometimes in the modeling world, we kind of focus our attention to one thing, but these are very good points, and these are based on biological information as well as human structure. I mean, how do people behave in the local community? And that's what you all are stressing is that is what is needed to build an effective model, basically. Okay, so I'll move on further with, to the second question, and this is to Maite and Paul. Anyone can take a lead on it. So in your opinion, how is these NPIs that we are talking about, they are, you know, we are all at home, and we see the problems are at home, at our hand, both from our professional side as well as if we are in taking classes. I mean, in actually being on time, being all the homework, and not seeing the instructor and not able to go to the office is very challenging. So how is this impacting the population, especially the diverse population or the underrepresented population? And are they coping it well? And they are learning it at the same capacity? And especially these NPIs are a very good way to bring out the motivation in them, actually. And I mean, you know, I'm hearing in the news nowadays that schools are closing or schools are opening. So that is there in my mind. I'm reading it every day as a student. And is that helping it? And if so, then are you guys are incorporating these features in your modeling exercise or in your research lab or in your teaching class? So again, it is question to all, but maybe Maite and Paul can take a lead on it.
Okay, I start, for example, here we are doing everything like classes remotely and things like that, but we have energy infrastructure are really bad. So people probably don't have internet access, or even I have problems at some point. So there are people here that are starting protesting so they can open the schools, and I'm opposed to it, like, because the kids are super spreaders. I talk about how the kids can get sick in schools and go home and make their parents sick, and then the parents go to work, and then how this network built. So that's a problem. The things that we are incorporating more social distancing than anything in our models, and we're trying to collect data right now. So, but in my epidemiology classes, I'm talking about this and how we can work in this. Other problems that we have, for example, is that people that work probably are leaving their kids with their elderly parents. So it's a really like, we're trying to protect them, but probably because of like disparities and things like that, like there's no way.
So is there any features that you have changed from prior to the COVID outbreak versus during the COVID outbreak in your teaching class, for examples?
Well,
to?
I'm teaching remotely everything, like teaching computer programming to my students has been a challenge doing it virtually. So I'm like recording. I doing everything synchronically, so they can like ask me questions and things like that. And then I record my classes, and then I put it up in a website, and they can go and share and things like that. So they're really working hard. They are really cooperating, and I'm impressed. Like they're really trying to graduate.
Cool. Yeah. Paul, you want to add something, Marissa?
Yeah, I mean, it's really interesting to think about both sides of this in terms of, they're, thinking about focusing on the modeling, right, and sort of forecasting or whatever. We really want to think about how things like, different sort of socioeconomic situations, different work and sort of living situations, how those things influence transmission and sort of outcomes, right? And so there's plenty of examples of this. Like I know, so Marissa knows more about this than me, right? But in Michigan, what happened in Detroit was a lot of early sort of part of what happened in Michigan, right? There's similar situations like in Southern California, there's some communities that are heavily sort of migrant workers, and they've been hit really, really hard by this, right? And a lot of that, it's not because of their genes, it's because of their living situation, their work situation, their access to information to sort of make better decisions, their ability to actually implement those decisions once they know that that's a choice that would be a good one in terms of reducing risk. So that side of it, I think a lot of us spend a lot of time thinking about. One of the things early on that I thought about with the modeling that I knew was not a thing I was going to be able to touch just because I don't have the background for it or access to the people that do, is thinking about the economic costs of this is really complicated, right? Because things like if you just have people that have a family situation where two parents working, all of a sudden somebody needs to take care of kids and somebody has to quit their job because they weren't making enough money to sort of justify keeping that job, right? Those kinds of things are economic costs and are a concern. And so so thinking about kind of how it goes back the other way is also really interesting. And I see this a lot with my students, right? When I talk to them, they're worried about getting it from their roommates. They're worried about getting it from coworkers. They're not worried about getting it in the classroom because of all the parts of their life, right? The universities have done a really good job of being like, no, you have to wear masks, and no, you have to socially isolate each other from each other. And even when people do that, I think not perfectly, right? They're still having a big effect on transmission rates on campus, right? And so I think a lot of what's happening, for my students anyway, is happening outside of the classroom. And you see in that situation that if they're living alone, right, they don't have as much of those concerns, but they need human interaction, right? And so there's that consequence. On the other hand, right, if they're living in a house with 3 generations in it, they're worried about getting their work done while they're helping, watch a younger sibling or a cousin or something. And they're worried about, making sure that grandma or grandpa or an aunt or an uncle doesn't get sick, right? And so, so yeah, so it gets complicated really quickly. And I think as people with the backgrounds that we have, it's not that we need to model those things, right? It's that we need to use the experience and our insights that we have from having this very quantitative sort of perspective on all this, right? Using that background and that knowledge to just sort of help sort of guide everyone managing all that stuff as best we can. I think that's an undervalued skill that a lot of modelers have, is that they actually have some nice insights into the processes at play here and how they all work together. And you can use that information in actionable ways without writing down equations and running simulations. So
yeah, connected to that is also, sorry to jump in, but mental health impact. There's been lots and lots of publications around this and data that suggests that mental health impact of COVID-19 epidemic on immigrants and actually racial and ethnic minorities. This is actually, they have a lot of data right now on this. So there's a whole group on social work working exactly on this topic of, the impact on mental aspects also. If you want to comment on that also, that'll be great. So.
I think a lot of the indirect impacts of, oh, sorry, Paul, you should give it,
I was just going to say that, like, I think your economic situation and your sort of access to healthcare is a big part of whether you have really sort of minor or really major sort of
consequences,
health impacts, mental health impacts. Sorry, go ahead.
No. I was just gonna say, I think that like the indirect impact of COVID, I think we like, we often don't sort of think about the full spectrum of what those consequences are, but they absolutely, like, I mean, in Michigan, you see a lot of this data too. I mean, whether it's unemployment, which is hitting, there's huge health disparities, or not health disparities, but economic disparities in terms of who's getting hit with, unemployment has improved, but it's improved way faster for white Michiganders than for Black Michiganders. Like, there's a lot of these disparities that are happening. And, even other health impacts, like we've seen hits to other vaccinations. So like regular childhood vaccinations that aren't happening because, people are concerned about going to the doctor. And so, there's a lot of like, I don't know, I think there's a lot of these indirect impacts that we're going to be unraveling for a long time, even after this is sort of resolved. Yeah. So I think that's the thing. And just to the like classroom thing, I think I definitely agree. Like, the classroom mitigation ends up meaning, a lot of universities that have seen outbreaks, they're seeing them, like faculty and staff are often like sort of worried because they're often in an older age group. They're concerned about getting it from students. It ends up being really not that. If they get it from the outbreak, it's usually because it went through the community and then they got it via the community. It's not directly from classrooms. I mean, I don't know. Yeah, I do wonder if either of you, I'm like, if I can jump in with a question to the panelists, I guess, have thoughts about like the value, like I don't know, we've been struggling with this a lot, thinking about this in Michigan, weighing K through 12 education, like the different, like elementary versus high school versus university level education. And, how much resources do you put into opening one or the other of those? I feel like, at least for us, we've spent a lot of time thinking about reopening University of Michigan, for instance, when, like, I don't know, from an economic perspective and a developmental perspective, I kind of think K through 6 is probably our most critical. I don't know if you all have thoughts about that.
Yeah, I mean, so I have an 8-year-old who's in 3rd grade. So I can talk about that part of it. I mean, going back to this idea of like, what's the risk, right? So my 8-year-old does what he's told and he goes where I let him go and he doesn't go where I don't let him go. And so when he goes to school, he's following all those rules there. And then when he comes home, he's not sneaking off to go play with his friends. He's not working in a place where he's going to come into a lot of interaction with the public. So, I mean, I feel like those sort of younger age groups, I mean, basically anybody who's living at home with parents and they're not, maybe high school that starts breaking down, they're I think pretty low risk in terms of the fact that they're not highly connected to others in the community. Whereas I think you're sort of like older high school students and college students, right? That transition there, the amount of sort of interaction between individuals in those age groups, as well as contacts with those age groups to others in the community, I think are very different. And I think that's an important sort of context to sort of think about there. So yeah, but I mean, just, like what you said, right now, I just got an email from our president yesterday at UNR that I think in our county, something like 1 in 8 of the new cases recently has been from people associated with the university, right?
Oh.
And a lot of that is not because of what's happening on campus. It's because people are just in these living situations and in these sort of social environments that it makes it really hard for people to do all the things that we would hope they would do. And we know that age group is very social and a little bit prone to risk-taking relative to the rest of the sort of age groups. So yeah, so anyway, go ahead, Mikey.
Yeah, one of the problems that I see is, for example, here is different. It's difficult because of budget cutting to like disinfect areas and things like that. And then one thing that I was talking to my students one day that we were like just blabbing things around is like, for example, a person that is positive, know that is sick, if he's quarantined at his house, if he lives alone, he needs to go buy groceries. He's probably gonna go to school. He's probably gonna go to work because he needs to. And it's not gonna take this care of like not infecting other people. So we don't know, right? This uncertainty of what people can do, people interaction is the problem. And then we can do more testing and things like that, but then you cannot disclosure who is sick or who's not sick, like because people don't want to be judged. So it's kind of like a give and take. Like, is it really people gonna behave? Like, for example, in the universities that they have these COVID parties and things like that. One of the news says one time that we take every measure, but we didn't know that people that were positive, students that were positive, were gonna go to parties and things like that.
So I think what you all are saying, if I sum it, what the discussion was in last few minutes, there is a differential risk, and the risk from, we cannot say that it is homogeneous in the sense, if I do not earn enough, I will take a risk much higher than the others who are having a more stable job, for example.
Mm-hmm.
And so that is one point. And second is what Paul that was mentioning about, I mean, even though these aspect of, I mean, we are having difficulty in teaching modeling, for example, but I think we can train them in a different way. We can train something different, which is from a compassion perspective and from the, I mean, we are not teaching mathematical truths, but since we read the scientific knowledge more rigorously and more thoroughly and more frequently, we are better informed in that sense, and we can guide them in that way. So what to do or what not to do, for examples. So so as a mentor, we are doing multiple jobs rather than just teaching mathematics and models, for examples. And another point that Marissa was mentioning about was, she mentioned about this high school versus preschools and all those groups. And I think you mentioned a few minutes ago was about age structured models. That was very critical. And how do you measure those different groups interacting with it? That becomes very relevant in these modeling world, for example. And all three of you touched this point of economic aspects inbuilt in these epidemic models. You cannot just isolate the epidemic models and study it. I mean, you can, but the point is it will not be able to capture the dynamics well. So I hope I have summed most of the points, if not all. I think we are short of time also, so I will OJ, you are saying something. I can see you are about to say something, but you stopped.
Yeah, I think as one of the organizers who kept his mouth shut by now, it's too much to ask of me. So if I could put in a few closing words. I'd like to thank all the panelists again for another really amazing webinar. Thank you for sharing your wisdom with us. My mother always used to say, it's rude to tell guests how delicious the cake you just yourself baked, but I'm going to break my mom's rule, and I'm going to brag about this webinar series that I am one of the co-organizers. This whole series, from starting with the first one up to today, was one of the best academic activities I have been part of and I have attended. I walked away from every single one of these webinar series with something I learned that I didn't know. I'm really grateful to all the panelists, starting from the first one and including all of them and today's speakers. And I'm especially grateful to my co-organizers, especially Sarah and Rebecca are the driving force behind making this webinar series happen. And my co-organizers, Anuj, Aditi, Padu, it was an amazing experience to be working with you all. And this is the last of the webinar series in calendar year 2020, but as the typical infomercials go, wait, there is more. So in almost a month, on November 13 to 15, we'll have the this year's famous beer symposium, beer for biomathematics and ecology education and research. And this year's beer symposium is the 13th meeting of the beer series. And due to its virtual nature, we'll have really much more flexibility than the previous 12 beer meetings. We are going to actually wrap up everything that we covered in these webinar series and more. And especially if you have also attended the any 3 of the webinar series, you'll have a significant discount in the registration fees and presentation fees in this beer conference. So in addition to attending the beer conference, I would encourage all of you to submit your COVID-related articles to Letters in Biomathematics. Letters in Biomathematics is publishing a special issue for COVID-19, and Anuj and I are co-editing this issue, and it has a rapid review process that actually gets the papers published at least provisionally approved within a week. And also, if any research projects that you do with or without COVID-related topics can be submitted in another journal that IBA sponsors, that's Spora. And if you actually look at the IBA's website, you'll see a link for Spora as well as Letters in Biomathematics. So I am once again grateful to all of our attendees. I'm grateful to all of our panelists and my co-organizers. I hope to see you all at the beer conference in November, and hope to see your submissions to either Letters in Biomathematics or Spora. With that, I leave the floor to my co-organizers.
Well, I think, Padu, you want to say a few things before we end about, so.
No, I think it's wonderful that you can all join from all these different parts of the world, and a special thanks to all the panelists for engaging discussion today. I think this is great, and we do hope to continue a similar set of series after the November meeting. So please try to attend the November meeting, because we are planning to put all the themes together that has happened, and both in the form of another new panel discussion, as well as hopefully have a report that will be produced from all 5 of them. So, it'll be a good way to catch up on things that you may have missed, because we had an education panel last time related to mathematical biology and one on parameter estimation. So we'll be doing all those as a summary report, and hopefully you get to read that also through Letters in Biomathematics as well. So thank you for attending.
Yeah, a final thing is that if all the panelists, if you mind sending some of your publications or some reports that we can post it on our website, that would be amazing. It will be very helpful to all the attendees. So thank you once again. And please do send us comments and suggestions, and we hope to continue like this in future.
Thank you all.